Hello and welcome to my channel. I want to look at a study that came out in the last couple of weeks that has not gotten much airtime in the mainstream media due to other important things that are going on in the world. This particular study was published in Vaccine, was available online on the 1st of December. It's titled Surveillance of COVID-19 Vaccine Safety Among Elderly Persons Age 65 and Older. And you see a list of the authors there. We want to jump down to the bottom and look at the potential conflicts of interest, which is very important whenever you look at a study to see if the study is funded by the pharmaceutical companies or if it's independent. This study lists that the co-authors from the FDA, a company called Acumen LLC, and the CMS declared no conflicts of interest. And they said they have no known competing financial interests or personal relationships that have appeared to influence the work reported in this paper. So that's all good. I like that. Looking back, there are 15 authors. Their associations are A, which is the FDA, B, which is a company called Acumen, and C is Stanford University, D is CMS. And I see that 9, including the principal author, are employed by the FDA. 6 are employed by Acumen LLC and 1 by CMS. Now, Acumen is a company in the San Francisco Bay Area. It's a nonprofit consulting agency, is my understanding, and according to usaspending.gov, they have been paid approximately $100 million a year for the last 3 years by the U.S. government. I'm glad to know that there are no financial or personal interests for any of these authors that put together this paper. So let's look at what the paper said. Everything that I have typed out here is directly from the study itself. So the abstract. They state monitoring safety outcomes following COVID vaccination is critical for understanding vaccine safety, especially when used in key populations such as elderly persons aged 65 and older who can benefit greatly from vaccination. That certainly sounds good. Monitoring safety outcomes following vaccination is critical, I would say, for any age, especially for those populations who can benefit greatly. Now, when I look at the risk and benefit ratios, if there's great benefit, we can possibly accept greater risk. We know those in age 70 or 75 and older were by a large majority the ones who have died from COVID, although many have died at younger age. But statistically, it's the older age that has been greatly impacted. But what about those who are at the lowest risk, who have the least benefit from vaccination? I think the safety monitoring outcomes would be even more critical for them. Just what I'm thinking. We present new findings from a nationally representative early warning system that may expand the safety knowledge base to further public trust and inform decision-making on vaccines, safety for government agency, or vaccine safety for government agencies, healthcare providers, interested stakeholders, and the public. Okay. So what were the methods? How did they perform this study? We evaluated 14 outcomes of interest following following COVID-19 vaccination using the U.S. Centers for Medicare and Medicaid Services, or CMS, data covering 30,712,000 elderly patients. Now, the way I read that, these outcomes of interest, and they are listed further in the study, and they are listed as, and these are the ones that they feel are most important that they should be monitoring: acute myocardial infarction, deep vein thrombosis, pulmonary embolism, disseminated intravascular coagulation, also called DIC, non-hemorrhagic stroke, immune thrombocytopenia, also called ITP, myocarditis, pericarditis, Guillain-Barré syndrome, Bell's palsy, encephalitis, transverse myelitis, narcolepsy, and appendicitis. Now, when CMS gets involved with patients, especially this is Medicare age patients, when they are billed for a service. So when a patient goes to a hospital, when a patient is seen by a doctor, a diagnosis and a procedure or billing code is generated, which is then submitted to CMS for payment. And I'm just thinking outside the box. I'm not making any assumptions here. But as far as these outcomes of interest, what if a patient's interaction, let me back up a second. Who are these patients? Who are in the study? So of the 30,712,000 elderly patients, 2.3% were nursing home patients. 97.7% were non-nursing home. So they lived at home or outside medical supervision. So again, just thinking outside the box, a patient has to be well enough to make it to call an ambulance, to see a doctor, to go to the hospital, go to the ER, in order for a service to be performed and CMS be billed. I'm not aware that funeral homes or coroner's office will bill CMS for services. Correct me if I'm wrong. It's just it's interesting to me that this list of 14 outcomes of interest omit at least one glaring outcome. So the study was conducted, or the data was from between December and of 2020 and January of 2022. That's 13 months. That sounds good. And a total of almost 35 million doses were given. And they looked at the data weekly and generated reports to see if observed outcome rates were occurring, and they compared them to historical rates prior to COVID. So they wanted to see if something was occurring more than what they were expected. And so what did they find? So the first thing they noticed was that 4 outcomes met the threshold following vaccination with the BNT162b2, that is Pfizer vaccine. And these included pulmonary embolism, acute MI, DIC, or ITP. As they evaluated it further, they decided that only PE really was significant and the rest were not. And then there were no statistical signals or meaning spikes for or versus expected for the Moderna or the J&J vaccines in this over 65 age group. So what was their interpretation? This early warning system is the first to identify temporal association for pulmonary embolism, acute MI, DIC, and ITP following the Pfizer vaccination in the elderly. Because an early warning system does not prove that vaccines cause these outcomes. More robust epidemiologic studies with adjustment for confounding factors, including age, nursing home residency, are underway to evaluate these signals. And then to close out, they state the FDA strongly believes the potential benefit of COVID-19 vaccination outweighs the potential risks of COVID-19 infection. That sounds like a blanket statement. I don't know for sure that was something that was addressed in this study, in this data, but that's what they believe. I think that's all I have for you on this. If you'd like to comment, I'd be glad to hear what you have to say. I know this Christmas is going to be hard for a lot of people. I've seen the comments on my previous videos that have just been heartbreaking. People that have lost loved ones suddenly in the past year. You're in my prayers. Thank you.